health issues are not handled typically with pharmacotherapy. Times when we do prescriptions, we are disappearing the signs and symptoms, not treating the psychopathology.
You don't see clients or a patient in front of you just with the physical the person is bringing to you. When you look at the person, is this person, even from the definition of health, we don't only look at the physical state of the client. And as he was saying, he clearly told me that that's one of his highest problems, and this I think that is associated with this is blood pressure.
We may put the carer into a story mode to also give us the story of the client. At times we have a better story from the carer instead of the patient itself.
The community, there is can say the stigma or the way people look at cases of mental disorders.
Yes.
If there is capacity building on incorporating the mental health into medical care, it's going to go a long way for
Hello everyone, welcome to another episode of Africa Health Insight. In today's episode, we shall be delving into the holistic approach of care, and we will be looking at mental health in medical care. As usual, we will not go on without acknowledging your contribution to this platform. Today I have with me, can you introduce yourself?
Thank you, Elvis. I'm Suiru Claudia, medical doctor in charge of non-communicable diseases.
Thank you for coming. And I have here, this is not the first time you are here, sir. Can you introduce yourself to our community?
Thank you very much for having me again on this platform. Etienne is my name, and I'm in charge of mental health.
How have you integrated mental health into medical care?
Thank you, Elvis. The holistic approach in medicine is very important. That you don't see clients or a patient in front of you just with the physical the person is bringing to you. When you look at the person, is this person, even from the definition of health, we don't only look at the physical state of the client, or looking at the mental health of the client, the social well-being, the environment, where the person is coming from. So in my practice in medical field, I see those cases on daily basis with the non-communicable disease, that's specifically hypertension and diabetes. And I will just share with you a case I happened to manage. This is a case of a 60-year-old man who was diagnosed with hypertension at 33 and has been managed for more than 5 years. And when I encounter this patient, the blood pressures keep on going above 170, the diastole of greater than 90. So I gave patient comes on 2 weekly rendezvous. We do workups to check for secondary hypertension. During the workups that were done, there was no pinpoint location of the hypertension. So this fateful day, I decided to ask the 60-year-old man, is it really okay? Who do you stay with? Where is your wife? So on questioning with this man, he told me he lives with his 25-year-old son, who, as he talks, he sheds his head and I could see a drop of tear from his eye. He says this 25-year-old son some days he can go for 2 days without coming home. Some days he comes at 4 o'clock and he has to knock the door for him to get up and open. And as he was saying, he clearly told me that that's one of his highest problems, and this I think that is associated with this is blood pressure. I discovered that this was beyond just the clinical aspect of it. So I proposed to him that I was going to inform someone in the mental department who was going to assist him so that we could really try to follow this hypertension. I proposed to him that we'll call in the son to come and assist and really see how we can manage and this blood pressure goes down. So on several occasions, I channeled into the mental health department where they did serial follow-ups. The boy in question was called. I remember he was referred to the Adolescent Friendly Service Center in which he was managed, and I think within 3 months the patient came back and the blood pressure went down to 130. For the past 2 years, I think he did not have that blood pressure.
Etienne, what is your experience with providing mental health services in our settings?
The need to look at mental health and integrating it into the medical aspect for a holistic practice. Plenty of experience in terms of managing mental health cases. When you say something is a mental health issue, it needs a mental health therapy. Mental health issues are not handled typically with pharmacotherapy. Times when we do prescriptions, we are disappearing the signs and symptoms, not treating the psychopathology. And so treating the psychopathology has to do with psychotherapy. This is what most people will not understand in terms of mental health, especially within the context of Cameroon, Africa. You just think that we have mental issues, we have to prescribe medication and it disappears. No, it disappears the signs and symptoms, not the psychopathology itself. Talking about managing mental health cases, with us, we do what we call an assessment first. And we cannot assess when there is no story. We may put the carer into a story mode to also give us the story of the client. At times, we have a better story from the carer instead of the patient itself. We go in now to scale the assessment, getting into a diagnosis using our manual called DSM-5. It gives us a spectrum. The DSM-5 tells us that when the scale is above 5 on 7, it means the patient or the client is positive at psychopathology. And so with that now, we now look for the psychological theories that must suit the scale of that psychopathology. And then from there now, we now start heating it up. From there, we look at the progress. We don't end there. We also look at a follow-up plan where the patient comes on weekly basis, depending on the spectrum of the psychopathology. One thing about mental health is that the patient or the client is actively involved in terms of evaluation to see whether things are moving forward or not.
What have you had as the biggest barriers in incorporating mental health into medical care in practice?
First of all, the fact that we are not mental health clinicians, and in our scope of work, it's true that it's normally a client in front of you should see from the holistic nature of it. But just the fact that the physician seeing these people who come to hospitals or in your various places, they are not the mental health clinicians first of all, but say limited knowledge in assessing for mental ailments or mental disorders. So first of all, the ability to identify that there is actually a mental disorder. Before now, because you can be treating a client, following up one consultation to another, and you will not identify that this patient has something more than just a physical state, that patient is bringing you just a light headache, but there is something behind that headache. Another challenge that we also have is that the community, there is, can say the stigma or the way people look at cases of mental disorders. And most of the times, the one that they even see, most of the times, is already the diseases. But though mental health is not only all about the disease, but in the community, they will see it as, some people will even call it as a curse, that they don't need to come to the hospital. It's a spell from the family. And this is one challenge that even because not to be able to even diagnose that is a problem, we don't see the people most of the times to diagnose it. And another issue is that there's also limited centers for this, for mental services. In each institution, there should be a mental health service there so that you diagnose or you're suspecting that this person needs mental attention, and you immediately even accompany the person there. You don't need to even refer to a different place, the person to go and see a mental health personnel.
What are some of those stressors you've identified in practice leading to mental health issues?
I had 3 sessions with a man who has always been having these little issues with a very high figure. I was shocked. That was his 4th session. He said there's something he has been doing which was surprising to him. He said each time he comes to the mental health department of the hospital and he goes back, takes his BP, it is lower than the one that was initially announced to him. So that begins to let me know that I am actually striking the root cause of it. Looking at the stressor this client had, the stressor came from his wife. So we are saying that in marriage could also be one of the stressors. Either the wife, the husband, children, or extended families. So we are not saying that marital issues are only in Cameroon, they are across Africa, Europe and Asia, of course. Looking at issues that has to do with conflict, substance abuse, depressive issues, and even work-related stress.
Incorporating mental health into medical care, what is the way forward?
I think the way forward to me is that we have to look at the level of the hospital milieu. What can be done? I think, like I earlier said, at the level of the clinicians, being it nurses or medical doctors, there is that limited knowledge.
Yeah.
So I think that if there is capacity building on incorporating the mental health into medical care, it's going to go long way for this management, for this holistic management. Also, I think that if there is education of the population, like in churches, in markets, radio stations, and the population is made to know that there are these services. There is actually mental health services where you can go and consult, you can go and see a clinician, and the clinician accompanies you or refers you to this place where you can go and see a mental health specialist is going to really help us. And in doing this, there are those beliefs, those cultures that believe in curses and things that the medical field cannot manage. It's really going to go a long way to address this our difficulties in incorporating mental health into medical care.
Once more, thank you for the discussion. People back home who actually benefit from this discussion, and they want, some of them want to identify you, to know if where they can locate you, because our parents, our grandparents, they are suffering from this non-communicable disease, and sometimes the origin is actually psychological mental health issues. We're going to leave a link in our comment section where you can locate Dr. Suiru, Mr. Etienne. And if we can get to them, you can have your issues addressed. So once more, thank you for coming.
Thank you, Elvis. It was a pleasure.
Thank you too for having me on the platform.
Yeah, thank you.
Yeah.